Hello, my name's Anne-Marie Moore. I'm the head here at Broadgreen Primary.
Hello, I'm Suzanne Evans. I'm the assistant head and mental health and wellbeing lead.
So we've been asked to speak to you about our mental health and wellbeing approach here at Broadgreen Primary. I'm going to talk to you initially about our whole school approach all the time, and then move on to talking about our adapted approach during Covid-19. So obviously our usual whole school approach encompasses all the stakeholders within our school. It starts with our whole school ethos to be there for all our children and their families, as well as our staff and the wider community. In terms of our pupils, we have a strong PSHE and safeguarding curriculum that is embedded throughout the whole school, that all staff follow. Their staff have had training around this to make sure they're fully aware. This has included the raw response following training from their Liverpool Learning Partnership. It ensures that we communicate well with our families and that we offer families support around their mental health and well-being as well.
To prepare for closure, what seems like a long time ago now, we immediately focused on health and wellbeing activities to support the children. We made sure we did some e-safety lessons because we want to acknowledge that lots of the learning would be on our learning platforms. We ensured that our pupils were able to log on to platforms and knew how to access learning. We set about creating some home learning packs with a real strong emphasis on health and wellbeing. We use booklets provided by our Liverpool Learning Partnerships, and we also included lots of physical activities that we knew that children could do in the home. We gave them out to children and we delivered them out to our families who weren't at school. And the big thing was trying to communicate with the families and let them know as much information as we had at that time. So sometimes it was our SLT, we go on the gate each morning and evening. So we were speaking face to face with parents, and others was through telephone, text and letters home.
So as we closed, our school closed because Liverpool took a hub model approach. So our school site closed and we were working in a hub in another local school. So any children of key workers came to the hub approach there. So that presented issues in that we were trying to keep our school family together whilst we were not, our own site wasn't open. So we made sure that we were still regularly communicating with our families. We asked all staff to create weekly home learning plans that were updated onto the website, and these always included mental health and wellbeing activities, including e-safety and a weekly PSHE lesson. And most recently, those have also included transition sessions as well to help children's understanding around that. We've also made sure we maintained communication with our families as best we could through various means of communication throughout. Some of it more targeted families, so we identified before we started vulnerable families who may have been either families from a safeguarding point of view, from a parent or child mental health viewpoint, and also our SEND pupils. And these have had weekly, if not twice weekly, phone calls. And this has also been backed up by regular contact between staff via email or via Twitter. And in addition to that, our educational mental health practitioner, who was working in our school for a long period prior to closure, has kept going with her support for our identified pupils, and I know parents have found that extremely useful. Also making sure that we acknowledge the lockdown for our children and their families, and didn't just try and hide away from it. So we've made sure that we've acknowledged it through giving the children specific tasks. So we did a time capsule task about how things that they've been doing during the lockdown, and then thinking about journaling and diary exercises for children, and also trying to keep certain elements of our school going like we would normally do by celebrating success, so giving out certificates and head teacher stickers for home learning, shout outs on Twitter, etc. You can see here on the little clip in the corner, we did a little May the 4th video with all our staff as Star Wars characters, and we also did a We're Missing You video that was posted on our school website just to keep that communication going with our families.
Yeah, so as Anne-Marie said, we gave our families regular updates via website and texting them just to reassure them that although they're not in school, we are very much part of the same family. We wanted to try and keep our community together as much as we could. So we signposted lots of different helplines and advice and activities through our website, and we also emailed individual families different support that we thought that they might find useful. Our mental health and wellbeing practitioners, as Anne-Marie said, kept in contact with both the children and the families via telephone and sometimes through video support. It was really useful as well. They kept in contact with ourselves, so they were able to let us know of new coffee mornings that were opening, new Zoom meetings that we could let our families know about. It also, for our families, lots of training courses started to pop up to help families in crisis, or to help families perhaps with SEND issues, and we obviously let our families know about those. We also did lots of referrals with other agencies for support. We work with the ADHD Foundation, and we were able to refer some of our families to get some one-to-one support. We're also work in partnership with Everton the Community, and they were able to provide practical help, such as going to the shops to get food for families who are isolating. We also wanted to let our families know about different initiatives out there, such as Action for Happiness, and give them strategies of how to cope with homeschool learning, and just how to spend time together with each other and cope at that time.
So we've just put a short video together which celebrates our home learning, and this was a way of keeping our school community together by sharing some clips of our children. Just play this for you.
Yeah, so we try to work with as many of our partners and other agencies as possible. We had ongoing support from our mental health networks, and we had regular emails from them, and if they had any, we worked as part of a network, and we were trying to share good practice between schools. So if some of our schools in our network had some good ideas, we shared them together so we could share them with our families. Our educational mental health practitioner, also we were able to refer new families who previously hadn't come onto our radar, but actually were in crisis in this point. So we were able to triage different families and get them some one-to-one help, and also, or if it wasn't one-to-one help, some courses that they might find useful. So we had regular updates through this time through CAMS, and also through lots of SEN providers, including the ADHD Foundation. And as also they offered lots of staff CPD opportunities. Lots of our staff were quite willing to go on, were quite willing to take these CPD opportunities up, so that they could provide help for their own class, because they were contacting their families regularly. So some of the staff CPD, our staff were able to do in between working in the hubs that Anne-Marie mentioned that we were working in. But for our staff, we recognised that this was a challenging time. Most of us weren't working in a school that wasn't our own. We were working with staff that we didn't know. So we wanted to try and find a way to let our staff know that we're still a staff, we're still a part of the same school. So we had daily check-ins for wellbeing. We had a lot of things, a lot of Zoom quizzes and photo activities, and just letting our staff know that if they needed support, where to go to. They had the opportunity to speak to educational psychologists if they needed it for themselves. We directed them to lots of wellbeing courses such as mindfulness, yoga, different ways of dealing with stress. I think the big thing for us was to try and let us know that we're all in this together. So we often did some group chats so that we could keep in touch even though we weren't physically seeing each other.
And so now we're preparing for the future, whatever the future looks like. I think the most important thing is that we keep the lines of communication open with our whole school family, because uncertainty adds to the stress for our families and our children and also our staff. So it's important that as soon as we know and we have a clear picture of what's going on, we share that all with our whole school community. Preparing for September, we've created transition videos for all classes, because obviously we can't do face-to-face transition like we would usually do. They're all available on our school website. Individual welcome booklets for each class, as well as personalised social story booklets for pupils with SEND, all trying to ease any anxieties that pupils might have around coming back to school in September. We've also focused on a recovery curriculum plan for September, starting with something that was sent out by the Liverpool Learning Partnership, and then building on that for us as a school with a real focus on mental health and wellbeing throughout phase 1 of the recovery curriculum. And just being aware that we want to be prepared for the future, but also recognising that we have to be adaptable for the uncertainties that lie ahead. Thanks very much for listening.
Thank you.